for Women about a new recommendation that is coming out that your OBGYN should also check your heart health when you go in for a visit. And Jen is here, so tell us about
Good morning, Robin.
these new recommendations.
This is huge news in women's health. This is really the first time that the nation's OBGYN Association, ACOG, collaborated officially with the American Heart Association. Why? Because we're talking about the #1 killer of women in this country, which is heart disease, and the fact that it has been recognized that OBGYNs are the definitive primary care physicians that most women see. So not to discuss risk factors for heart disease and to do screening for those risk factors is a massive missed opportunity over the course of a woman's lifetime.
We are hearing more and more about the gender differences when it comes to that.
Right.
Explain more about that.
It's not just about what causes heart disease differently in women than men. It's not just about the fact they can have different symptoms. If you look at these risk factors, this is staggering. For the same risk factor, when you put it head to head, diabetes, a woman with diabetes has a 19% increased risk of heart disease. A man with diabetes, only a 10% increase. If you take an obese woman, that increases her risk for heart disease by 64%. In an obese man, just 46%. Wow. So when you look at these risk factors that are identifiable oftentimes at your well-woman OBGYN checkup, this is a target to risk reduction in terms of behavior, lifestyle, and in some cases medication.
Give us more of a bottom line here.
Well, look, women need to know that there are reproductive health issues that occur in pregnancy and in gynecology that are known to be stress tests for women. They are risk factors for future heart disease. So just under pregnancy, you're talking about gestational diabetes, preeclampsia, a preterm delivery, polycystic ovarian syndrome, which affects about 10% of women, and hormone use in some cases, either hormone replacement therapy or the pill if a woman smokes. These are things that are in the OBGYN primary care wheelhouse, and they are known to affect a woman's risk of heart disease. So very exciting. One hand has to talk to the other now.
I'm about to say, now, how is that going to work?
Well, look, our women can actually educate their doctors.
Good, yeah.
When they go to their doctors, say, did you know now that you're supposed to be collaborating with the cardiology colleagues? In my family, Robin, my father's a cardiologist, so this has literally been in my blood. But I am so happy to see this official collaboration happening.
I can hear women calling. I saw Dr. Jen on GMA, and she said what happened was...
You better,
you
you better talk to your colleagues.